my name is Elias Burkle, and this is my presentation on pleural effusion. Learning objectives. By the end of this presentation, the learner will be able to understand what causes a pleural effusion, understand what the symptoms of pleural effusion is, or are, understand what treatments can be done for pleural effusion. A brief overview of the condition. Pleural effusion is a buildup of fluid between the layers of tissue or pleura that line the outside of the lungs. You can see in this image the buildup of fluid. There are two types, transidative pleural effusion and exudative effusion. Exudative effusion is protein-rich buildup, and this can be caused by a lung injury, tumors, blocked blood vessels, blocked lymph vessels, or infection. Transidative pleural effusion is a water-rich fluid buildup, and this can be caused by high blood pressure in the blood vessels or low protein counts. This often leads to heart failure. Treatments include using sclerosing agents to create fibrosis and harden up the area. This kind of just intentional scarring. Draining, that's through a procedure known as thoracotomy. I hope I'm pronouncing that right. Or treating the heart problems or cancer causing it, as previously mentioned. Tumors can cause exudative effusion, and blood pressure issues can cause both. Normal physiology. Pleura is tissue on the outside of the lungs / the inside of the chest cavity that lubricate and aid in breathing. They protect and cushion the lungs. They are connected so tightly to the lungs that they cannot be separated, and what helps it lubricate the chest cavity is the pleural fluid that it produces. Disruption to normal physiology. The excess fluid putting pressure on the heart and lungs can cause shortness of breath, sharp pain in the chest, coughing, particularly a painful cough, and difficulty breathing unless sitting upright. This can lead to heart failure, specifically and most often with transidative pleural effusion. Patient symptoms. Patient comes in and they present with chest pain, especially when coughing. His coughs are unproductive, so that means nothing's coming out. And he struggles with breathing unless sitting upright. You should use a CT scan or an X-ray for the diagnosis, and a thoracotomy, that sounds right, to repair the pleura and drain the fluid. There's a little diagram of the procedure. These are my references, and let me know if you have any questions.